Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about emergency services and the certifications that help the public know where to seek the fastest, most effective care in their area. We'll learn about Certified Trauma Center, Accredited Chest Pain Center, and Primary Stroke Center from three guests from St. Tammany Health System. We'll start off with Bethany Monistere, who is Trauma Services Manager for St. Tammany Health System. Bethany, welcome to the program.
Hello, thank you for having me.
I'm excited to have you here. We're going to talk a little bit about what a trauma center is and what St. Tammany Health System has to offer people who are in need in that situation where trauma response is necessary. So maybe let's start right off the bat with what is a trauma designation?
So our trauma designation comes from the state of Louisiana, but we're also accredited by the American College of Surgeons. So we went through a vigorous accreditation survey where the American College of Surgeons comes in and they have a certain protocol that we have to follow. It's where we have resources available 24/7 for patients who come in critically injured from car accidents or gunshot wounds, stab wounds, unfortunate events that can happen. But we're prepared 24/7 for this, and the American College of Surgeons really provides that blank protocol for hospitals to follow.
Okay, so that American College of Surgeons designation or certification suggests that St. Tammany Health System and your team have gone through the training and have the personnel, the people with the specialties and the backgrounds, and that all of those resources are drilled and trained and ready so that when a trauma happens, this facility is prepared.
Correct.
Okay. Well, then that trauma center designation is a little bit of a badge of pride, but really it is there to create some confidence in our public to understand that we're ready to take care of them in these kinds of emergencies.
Absolutely.
And you mentioned that aside from the American College of Surgeons, that this is also a designation with the state of Louisiana. And that's part of a larger emergency response network. So can you talk a little bit about what our state puts together for emergency response?
So part of our state is the Louisiana Emergency Response Network. It's a great part of our government that works with emergency personnel, first responders, and our hospitals. So when there is a hurricane or a bad car accident on the interstate that has multiple victims, they work together in their communication center to route these patients so not everyone ends up at the same hospital. It spreads out all of the patients throughout all of the resources that we have throughout the entire state, and it's a really good asset for our hospitals locally and statewide, especially when we have things such as hurricanes or tornadoes or really bad accidents, because our main corridor on I-12 is a very, very busy, heavy traffic area.
Very good. So for those of us who are not clinical people or don't work in emergency services or in trauma care, we really don't think on a moment-to-moment basis about what would happen if an emergency occurred, how we would be transported to a hospital, or how that hospital could be chosen. And what you're saying is there's an enormous amount of thought and logistics and planning statewide and regionally, and then here very locally within the 5 hospitals in our area.
Yes, we do. We have a strategic plan, and we work very closely with our first responders. So every ambulance company that we have throughout our region is very familiar with each and every hospital. We communicate on a daily basis of what services we have and what we can offer to the public. So if you do fall down and break your leg, yes, it's an accident, but that is still considered trauma. So you don't want to end up at a hospital that doesn't have a service that can provide you the care that you need. So our local first responders can bring you to the appropriate hospital that can take care of your needs in a timely manner.
So in the case of a trauma, where, you talked about the interstate, well, all the first responders are going to respond to that. You're going to have ambulances responding to that. The LEARN network is going to be in action, sending those ambulances to each hospital with the appropriate care. But for someone, as you mentioned, who's broken a limb, that kind of a trauma, there may be a private decision going on of, do we throw someone in the vehicle and drive to a hospital? Should we call 911? Can you talk for a minute about the role of making that phone call 911 in a trauma situation?
So 911 is one of the best resources that anyone has at their fingertips. So we always advocate in the emergency department to pick up the phone and call 911. A lot of residents don't realize you get care before you get to the hospital. You have an IV placed, you have pain medicine that they can give you, oxygen if you need it. It's very important, and they give the hospital that brief 5 to 10 minutes to get ready for everyone on the team to be prepared for what's coming in their doors. The emergency room is always prepared for whatever walks in, but when we have that brief 5 to 10 minute heads up on what's coming in, it actually helps our team better prepare for what's coming in. So when you come in and you do have 20 people at your bedside, it is for a reason. Everyone has their task, and we get things done very quickly. And this is with any kind of incident that you have, whether it's a trauma or a heart attack or a stroke. It's very important to call 911 and not try to put someone in your vehicle and drive them all the way to the hospital by yourself.
Okay, so for those of us who are not clinical people, you know, we find ourselves in a situation and it's up to us to decide how to respond, and we're thinking, oh, if I call 911, we're going to have to wait. We actually need to rethink that, because if we call 911, that wait is actually shorter, because the minute that those medical professionals show up at our door, they can begin intervention, they can begin medical care that we would not have if we were trying to drive to the hospital.
Yes, ma'am.
And then in addition to that, I heard you say that once I get to the hospital in my private vehicle, you have everyone ready, but you don't know what's coming in the door, whereas the ambulance has already communicated.
Yes, so our EMS personnel call a designated phone line that we have in the emergency department. So we have a clear line of communication with EMS. We know what's coming in. We can have, whether it's the trauma surgeon or the orthopedic, which can fix bones, and or if you're having a heart attack or a stroke, we can have that equipment at the bedside that we need ready for you. It may take, you know, if you walk in our front door with a trauma, it may take a couple of minutes for us to get the special equipment that we need. We are prepared, but we can be better prepared when you do come in with emergency personnel.
Perfect. And so that's a thing that a private citizen can do, is call 911. But another thing that private citizens can do if they're trained is help to stop the bleed. And you have a whole program called Stop the Bleed that you're doing in the community. Can you tell what that program is, and then how we can go about getting signed up to get trained?
Absolutely. So Stop the Bleed is a worldwide program that part of the American College of Surgeons put together, training that anyone, medically trained or not medically trained, can learn to stop bleeding, because the #1 cause of a preventable death is bleeding. So this is something that we can train anyone to stop someone from bleeding to death. And as tragic as that sounds, if we can be proactive and we can train someone how to apply a tourniquet or how to apply appropriate amount of pressure to a bleeding source until first responders get there, they have the potential to save someone's life. So we're not using blood products that we don't need to use, and we don't want to be wasteful with our blood products. And if we can train the lay public on how to stop the bleed, just like we would with, some people get worried with CPR because it's a lot of stuff to remember. Stop the Bleed is basic training. We do provide classes to the public. You can sign up for those classes at sttammany.health. We have a couple, 1 to 2 a month, and we offer these classes to the public. We have also taught these classes in St. Tammany Public Schools to our teachers and staff members there, so they are prepared. So you can feel a little bit safer when you're sending your children to school.
That's beautiful. Bethany, thank you so much for this. Stop the Bleed and helping us understand a trauma center and what's important about calling 911. Thanks for coming in.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about emergency services and the kinds of certifications that help the public know where to get the fastest, most effective care in a trauma, a stroke situation, or when having a heart attack. We'll be right back.